So the first part of this is safe sex. A lot of times people think having sex without protection is okay. Well, it's not okay. Unless if you are in a super faithful relationship, then having sex without protection is okay. Only then. When in need of protection, use the following: a condom, female condom, abstinence, meaning not having sex at all, which is the best protection, spermicide, diaphragm, Depo-Provera, the patch, cervical cap, and the pill. I'll be talking about all these different types of birth control methods in the next scenes. First off, there's the condom. This is slid onto the male's penis, made to hold back any sperm from entering the vagina. Second, there's the female condom. It is made from a soft, loose-fitting polyurethane plastic shaped like a pouch and has a soft ring at each end. The ring at the closed end is used to put the device inside the vagina and holds it into place. The other ring stays outside the vagina and partly covers the outer lip or labia. Third, there's abstinence. This is the method of not having sex at all. This is obviously the best way because there's no contact in any way. Fourth is the spermicide. All contraceptive spermicide available in BC at the present time contain the sperm-killing chemical noxinol 9 and work by setting up a chemical block by the entrance to the uterus. Here, sperm are trapped by the foam or gel barrier and destroyed by the chemical. Amount of noxinol 9 varies depending on the type of brand of spermicide. Now, fifth is Depo-Provera. Depo-Provera is a long-acting form of birth control using only the progestins hormone. It is given by injection and repeated every 12 weeks. You need a prescription to get Depo-Provera. Sixth is the patch. You place the patch on one of four areas: buttock, abdomen, upper body, not the breast, or upper outer arm. You change the patch once every week until the end of the fourth week when you're on your period. Seventh is the cervical cap. A cervical cap is a method of birth control. It is a small device made of soft latex rubber that fits over the cervix. Cervical caps come in different sizes and must be fitted by a clinician. It is held in place by suction so that the sperm cannot enter the uterus. Lastly is the pill. The pill must be taken every day at the same time for as long as you don't want to get pregnant. These are not all the birth control methods, these are just some. If you want more types of methods, feel free to research it. There are many STDs, but I'll be covering 5 STDs in the next few minutes. The first STD is chlamydia. Chlamydia is caused by the bacterium Chlamydia trachomatis. This bacteria can affect the cervix in women and the urethra and rectum in both men and women. Occasionally, chlamydia can also affect other parts of the body, including the throat and eyes. Chlamydia often has no symptoms, especially among women. If left untreated, chlamydia can cause serious problems later in life. Second is gonorrhea. Gonorrhea affects both men and women and can infect cervix, urethra, rectum, anus, and throat. Gonorrhea is one of the most common sexually transmitted diseases, and the global gonorrhea statistics show that an estimated 62 million cases of gonorrhea occur each year, affecting more women than men. Gonorrhea is easily curable, but if left untreated, it can cause serious health problems such as pelvic inflammatory disease, which can lead to abdominal pain and ectopic pregnancy in women. Untreated gonorrhea can also lead to infertility, meningitis, and septicemia. Third is genital herpes. Genital herpes is a sexually transmitted disease caused by the herpes simplex virus type 1 HSV1 or type 2 HSV2. Most individuals infected with HSV1 or HSV2 experience either no symptoms or have very mild symptoms that go unnoticed or are mistaken for another skin condition. Because of this, most people infected with HSV2 are not aware of their infection. When symptoms do occur, they typically appear as one or more blisters on or around the genitals, rectum, or mouth. The blisters break and leave painful sores that may take 2 to 4 weeks to heal. Experiencing these symptoms is sometimes referred to having an outbreak. The first time someone has an outbreak, they may also experience flu-like symptoms such as fever, body aches, and swollen glands. The fourth one is HIV. HIV is a virus. Viruses such as HIV cannot grow or reproduce on their own. They need to infect the cells of a living organism in order to replicate, meaning make new copies of themselves. The human immune system usually finds and kills viruses fairly quickly, but HIV attacks the immune system itself, the very thing that would normally get rid of the virus. The last part of this is pubic lice. So, pubic lice, also called crab lice or crabs, are parasitic insects found primarily in the pubic or genital areas of a human. Pubic lice infestations is found worldwide and occurs in all races, ethnic groups, and levels of society. That's all, but this is not all of the types of STDs in the world. There are many more, and you can feel free to go and research it yourself. A lot of times, people are pressured into having sex. I feel this is one of the most important topics to talk about because this should not happen. Peer pressure can start off from a couple of guys hanging out, then one of them bring up the topic of getting laid. So they all tell the guy with the girlfriend to go get it on with the girl when he really doesn't want to. When being in a situation, you really should always say no, try to avoid the conversation, or bringing up a different topic, or simply just reason with them and say you're not ready. The worst time people are peer pressured into having sex is when they're in their teens. This being because it would make them be it would make them be the coolest guy or make him the top in his group. But without knowing that if he has sex with the girl, that same girl would most likely also be known as a slut or prostitute because she had sex at a young age. When being pressured into having sex, say no unless if you know you're ready. Don't listen to your friends. Don't listen to your friends all the time because sometimes most likely they haven't been in the situation yet. In the next part, I will explain the different consequences of having sex. When having sex at a young age, the worst thing can happen. In this short clip, I will be talking about why you should not have sex at a young age and explain how it is bad. First off, when having sex at a young age, you're most likely not going to be smart enough to use protection. This exposes you and your girlfriend to STDs and maybe even having a baby. Most teens think it would be more fun to have sex without any protection but without knowing there are so many STDs such as the 5 I had introduced to you from before. You could get AIDS, genital herpes, genital warts, HIV, hepatitis B, pubic lice, gonorrhea, chlamydia, and much more. Now the second consequence of having sex at a young age is the responsibilities. This being the care for a child, if there is one, paying the different costs for the child such as clothing, food, diapers, and etc. When having a baby, the care for it is very, very important. If both people in the couple aren't willing to care for it, then they both weren't ready for sex. When having sex, you should have sex with a faithful partner who will share all responsibilities reviewed from before. So be careful when choosing your partner. In conclusion, I want to say sex is not something to be taken as a joke, so be careful. Thank you for your time. Feel free to research more on this topic.